All right, it is 4 o'clock, the time we get together just about every day, go over a few updates in state government, give our COVID report, and talk about what it's going to take to defeat this virus. Today, we've got Franklin County High School, the Flyers. They are doing their part through their masks, also well constructed and comfortable to make sure that their students and their faculty are going to be safe when they return to in-person classes on September 28th, or what they decide based on recent guidance that we have put out. This is from their principal. We appreciate it, and we're going to make sure we do everything to keep them and their kids as safe as we can, and their parents and faculty as informed as we can. All right, let's start off with today's Fast 4, which is an update on 4 areas of government as we work into our COVID report, but a chance for everybody to keep up with a number of the things we're doing, investments we're making, ways we're moving the state forward, because there is still so much more going on than this virus, and we want to make sure that people know different steps we are taking, whether it is on the virus or in other areas of government. So the first is another round of funding that is going out to local governments that we're reimbursing for their work related to COVID. This week, we've announced more than $10.8 million to local governments in northern and central Kentucky. So today, we're announcing another $2.7 million to 18 local governments in eastern Kentucky. The governments being reimbursed are Bath, Estill, Floyd, Harlan, Knox, Leslie, Menifee, Owsley, and Wolfe County, and then Barberville, Camargo, Clay City, Elkhorn City, Grayson, Manchester, Pineville, South Shore, and West Liberty. Once again, this helps to make local governments whole, helps them to cover first responder, law enforcement, PPE they've had to purchase, and other programs that they have engaged in. We appreciate our local leaders. We need you to keep it up. The virus isn't gone. We can't be tired. This is one way we can show our appreciation and make sure you are also strong as a local government and as a community, so that when we get through this, we really run ahead. We make those gains that we've wanted to be making this last year. We make up every bit of ground. We provide opportunity for all Kentuckians, and we build the type of Commonwealth that we've all dreamed of. All right. This week is also National Direct Support Professional Week. That's September 13th to 19th, and it's when we pause to honor the dedication of a special group of frontline heroes and recognize the important work of direct support professionals, they're called DSPs, that they provide every day to Kentuckians with disabilities. This year, our direct support professionals have been called upon to meet the challenge of COVID-19 like so many others. DSPs from across the Commonwealth have made personal sacrifices to both support and protect those they serve. Some examples include DSPs who have volunteered to move into residential homes to avoid multiple staff coming and going and increasing the risk of exposure. That's pretty special. Many DSPs have chosen to reduce contacts in their own personal lives, knowing how important those they work with are, but also how vulnerable that they are. This is the type of sacrifice that we need from everyone, knowing that we've got to give up some of the things we do and we like to protect other people, and our DSPs are a great example of people who have certainly taken it to an amazing level. Over the past 6 months, they've worked tirelessly to ensure that people are not only healthy, but happy at home. We extend a sincere thank you to Kentucky's direct support professionals whose dedication has saved countless lives during this pandemic. You see a lot of them over here. They are an incredibly important part of Team Kentucky. Thank you for helping us to get through this, and because of you, we're going to get through it together. We appreciate everything that they are doing. All right. Again, we're going to talk about voting. We're going to talk about voting because in this general election that's coming up, you have more options to vote than ever before, and we really want to break a turnout record here in Kentucky. It would show that we are not just good citizens when it comes to fighting COVID, but we believe that voting is our civic duty. So first, let's put up the overall general election registration deadline. We haven't talked about this piece a lot. You have to register by October 5th at 4 p.m. You can do it at elect.ky.gov to make sure you can vote in this general election. Now, there are some people who would be registering for the first time that have moved to Kentucky that haven't registered. We want you to go online. But we also want you to go online and register if you're one of the 190,000 Kentuckians that have had their voting rights restored based on one of the first executive orders that I signed as governor. If you want to know if you are included in it, we have a website that is set up to where you can get online, you can go to it, you can see your name there, and you can have that extra reassurance that you should and can register at elect.ky.gov. But this website is civilrightsrestoration.ky.gov. And one of my favorite days as governor, one of my favorite days, and I think about the favorite days a lot right now, is when I was able to sign that executive order and was there with two Kentuckians who had never been able to vote because they lost their rights when they were 18. They both had kids. Their kids had never seen them vote. And their excitement to be able to not only do their duty, but teach their kids and show them how important it is. Let's make sure that everybody out there who has regained the right to vote registers, checks on their status. Please, become a part of society in this way again. And I think those that have lost the right to vote would tell you just how important it is. What voting does, how it makes you feel, how it reassures you that you are a part. So we want to make sure everybody registers. Remember, your deadline is October the 4th? If you could bring that slide back up. October the 5th at 4 p.m. at elect.ky.gov. And then you can request your absentee ballot if you are concerned about COVID or otherwise qualify at that same website, elect.ky.gov. All right, finally, every day we're trying to recognize those that are out there doing the right things, fighting COVID-19. James, did you get a copy of the quote from the CDC director today on masks? All right, this is Robert Redfield, the CDC director. And today he testified and he said the following: wearing a mask remains the most important, powerful public health tool we have. It's the head of the CDC in the president's administration. Someone that works directly with this White House saying the exact same thing that we're saying. It's not a Republican thing, it's not a Democratic thing, it's a science thing that we know works. It's a public health thing that we know works. It is a fact. And wearing one of these helps protect the people around you. We showed you that video from that doctor in Bowling Green who we've lost, who was on the front lines of fighting COVID. Her last public interview was about, wouldn't you wear a mask if you knew it would protect someone, even if you'd never met them? That's pretty powerful from someone who gave her life fighting this virus. We need you to wear a mask, and we want to recognize those that not only are out there doing it, but they want to set an example for other people. One way to do that is filling up social media at Team Kentucky or Mask Up KY. So the first one we want to show it has some of our healthcare professionals, and it's all the way, you got to look in some of the most sophisticated masks, because they have begun a mobile testing site in Muhlenberg County this week. One of the major success stories that we have had in Kentucky is our testing. Right now, testing continues to go up or remain stable in the Commonwealth while it is going down in other places. That's one of the reasons that our positivity rate is going down, that more people are getting tested, but we're also finding those that are testing positive, and we're going to have an update on contact tracing here in just a little bit. That's what gives us an opportunity to find those that might be spreading the virus, to make sure they get the help that they need. If they need medical care, they get it, but that we can also quarantine them and those that have been in direct contact so that we can defeat this virus and make sure it doesn't spread further. So thank you to everybody involved: Owensboro Health, Muhlenberg County Hospital, Pools Pharmacy, Clinic Pharmacy, Felix E. Martin Jr. Foundation, and the director, Kathy Bethel. We appreciate your work. Remember, only a certain number of these are put together by the state. You know, we got ones with U of L now, UK, and Northern Kentucky. We provide kits to a lot of other places, but it is local heroes that set these up, that do these tests, that really care about their community. So the next time you get a call, and Mark Carter can talk about this, and somebody says you've been in contact, you're going to need to quarantine, and you think about arguing about it, remember, these are the folks that are talking to you. These are the local health department folks that are putting on all this PPE, that are testing people that they know have COVID, that they are putting their very lives on the line. The least we can do is listen to them, follow their advice, and treat them with the respect that they deserve. All right, next one. This is Ashley Wilson getting her first PT visit. Remember that we've got a lot of other health conditions. We need to be seeing our physicians. You need to get your flu shot. I went in and got my physical. I'd put it off a little while because of COVID, but now it is safe. These facilities are making sure that they follow the very best practices. When you go, wear your mask. And if you're going to get the doctor's visits you need and you wear a mask there, surely we can all agree that we would want to wear a mask in schools, around our kids, making sure that we can also keep them virus-free. And the last one, he's leading the way, right? We often talk about how our youth lead the way. This is him getting his flu shot to stay healthy. Folks, everybody needs to get a flu shot. Everybody. It is incredibly important this year. Our fight against COVID will become so much more difficult if you don't get that flu shot. Our ability to be overrun in our hospitals becomes significantly more likely if you don't get your flu shot. Difficulty keeping kids in person, in classes, hybrid model or otherwise, once that really starts September 28th, will be much more difficult to keep going if you don't get your flu shot. So the moral of our story that we're living right now is get your flu shot. I'm getting mine tomorrow, as is my wife, my daughter, and my son. We're going to do it. We hope everybody else does it as well. Want to move from there into our COVID report, and then we're going to have Mark Carter give us an update on contact tracing. So I want to start. The White House sent a new report to us, as they do every week, and they've recognized what we've talked about. We've got some numbers going in the right direction. Mainly our positivity rate. Our overall numbers are a little bit lower this week, but that's maybe in large part because of the Labor Day weekend and our labs, but we don't see them increasing at the moment. So both of those are noted in that report, which will be online. The White House did give us our counties, once again, that they view in the red and in the yellow. So for the first time since we've been getting these reports, both Jefferson and Fayette County and those metro areas are not listed in the red zone. First time in their reports. Warren County and the city of Bowling Green is still there, and it is still the number one concern of the White House when we talk to them. So when you look here, it's a number of counties: Warren, Christian, Laurel, Greene, Union, Lewis, Logan, Grayson, Monroe, Russell, Trigg, Marshall, and Livingston. And if you looked at our incident rate map, you would see a lot of crossover in between what's up here and what's on there. They don't line up directly. This is the White House's data, but you would see some significant overlap between them. I know on our incident map as of yesterday, both Warren and Greene were both in the red. Yellow, pretty big list, but I will say that we have fewer overall counties between red and yellow than we did last week. So a significant number, and what this says is, we got to be careful that COVID is everywhere. Now we're trying to provide one extra step of analysis to help our localities in that we have a green, yellow, orange. Sometimes people say the stoplight was orange and red. And that's supposed to let you know when you're approaching red, if you don't want to hit red, it's time to start taking steps. Again, we want to make sure every time we get information like this from the White House that we're transparent about it, even if it doesn't always line up exactly. Our COVID report today is 776 new positive cases of COVID-19. 91 of them are kids under 18. We continue to see this trend where more and more kids are testing positive. They're becoming a bigger percentage. I think it's for a couple reasons. One, thankfully, kids are being tested more often. Two, they're out doing more. But remember, when we're making these decisions, our belief is that kids can transmit this virus as easily as anybody else. Our positivity rate for the second straight day is below 4% at 3.89%. We're getting close to 1.1 million tests performed in Kentucky. We have 1,090,162. We have 565 Kentuckians currently hospitalized because of COVID, 125 in the ICU, 75 on a ventilator. So let's make sure we pray for them. Our total cases, this goes all the way back to March the 6th now, 58,764, and with 8 new deaths today, now at 1,082 deaths. New cases by county: Jefferson 137, Warren 37, Madison 33, Bullitt and Fayette each at 28, Oldham at 25, Hardin at 22, Davis at 21, Estill County at 18. That's a lot of cases for Estill County. Campbell, Christian, and Logan all with 16. That's a lot of cases for Logan. McCracken at 15, Caldwell and Laurel at 14, Barron and Whitley at 13, Boone at 11, and then Greenup, Henderson, Hopkins, Martin, and Muhlenberg all at 10. Remember, COVID-19 doesn't care about your county line, whether you are rural or urban. Both the White House report and anyone that we would put out would say that COVID is spreading in both, and at any point can have a breakout in a county. So that's why the data we're going to be providing, incident rates and the rest, is so important, because decisions now in many instances are going to have to be week to week, and that's just what we're going to be living in. It's going to create some uncertainty, but it's going to help us to do more during those weeks at least, that you're in the green or that you're in the yellow. People that we have lost, included in today's report, a 49-year-old woman from Christian County. We've had a lot of people in their 40s in the last week or two. 84-year-old woman from Greenup, a 74-year-old man from Jackson, an 83-year-old man from Montgomery, and a 68-year-old man from Montgomery, 88-year-old man from Union, 66-year-old man from Fayette, and a 76-year-old man from Christian. Now, I saw a story out there based on there being a lag between people in a community knowing when someone has passed and us reporting it here. Remember, we have a committee that it has to go through. They have to determine that COVID was a contributing factor to the death, which means the documents have to come in. So for that accuracy, because we believe that those numbers are accurate, that we take those extra steps, which takes a little more time. A couple of new areas that we track: K through 12 schools. We have an additional 41 students that have tested positive, and another 6 staff members or faculty, another 13 schools represented on that. Colleges and universities, at least another 4 students since yesterday. Now, I don't think we put this up yesterday, but you can see that the numbers are pretty large in our universities. And then in long-term care, 18 new residents, 22 new staff have tested positive, 6 new deaths attributed to long-term care facilities, 1 new facility overall. So in general, what we're seeing is we still have higher case numbers than we'd like to see. But we don't at the moment see those accelerating from last week or the week before. That's a good thing. We see our positivity rate coming down some, and that's a good thing. But remember, whether our mortality rate is 2, it's now below 2, 1.8, 1.7, wherever it is this week. If you multiply that by the 770 plus cases we had today, anytime we have a lot of cases, it's going to result in us losing people we care about. So let's make sure that we not only are keeping that positivity rate down, we actually get our cases moving down, because Kentuckians' lives depend on it. Until then, realize people are hurting. I don't know if you're a person that looks at the obituaries when you read through a newspaper, but just to see the number of people that will even talk about in that spot for their loved one, it being COVID related, we'll talk about just how difficult it is, or even if it's not, how difficult the funeral or the lack of a funeral because of it is. So let's make sure we light those houses green. Let's make sure we ring those bells at 10 a.m. And we're still going to suffer a lot of loss, and our people are going to need your help. Right before I bring Mark Carter up, let me go back to voting for one important thing. If you are in Fayette County, you may have seen a news story about absentee ballots being delayed. Thanks to the work of a lot of local officials, that has been fixed. They are not going to be delayed. So if you are in Fayette County and you want to vote via absentee, you can still have confidence to do that. So again, you can go online, elect.ky.gov, and request that ballot. If you fall in any of those concern areas for COVID-19, I would encourage you to vote absentee, which means you should do it now. You should do it today so that you can get that ballot, and when you get it, you should return it as quickly as possible. I believe tomorrow we're going to have the Secretary of State and the head of our Board of Elections to come in and talk through, when you get it, what you do with your absentee ballot, making sure you don't make any mistakes on it. Make sure that we fully educate people on that. All right, so now we're going to have an update on contact tracing from Mark Carter.
I think the last time I was here, I walked off with the governor's notes, and he's a quick study because he took them with him this time. Thank you for having me, Governor, to give an update on contact tracing. I have just a few things I'd like to talk about, starting with staffing. As you can see on the slide here, we've added a considerable number of folks to the contact tracing effort across the Commonwealth. Those numbers total up to 1,240 staff members who are doing contact tracing and disease investigation across the Commonwealth. We are not quite at our total budgeted capacity. We have roughly 120, 130 additional spots that we could fill, and we continue to do that. I think that of 120 counties or 61 health departments, just all but a few have added staff through this process, and those that haven't have been using the regional teams that we established as part of this effort. So a significant increase in just a few short months on staffing. And the second matter is our system, our contact tracing and tracking system, our CTT system. We made a considerable effort during the month of August and the first part of September to increase the utilization of that system and across all of our health departments. It had been deployed across the state, but we weren't quite getting the utilization we expected and the data that we needed out of it. So there was a significant effort primarily during the month of August to do that, and I'm happy to report that we're in a very good place there. We had really assistance from every health department director in the Commonwealth, and I do want to call them out. I did see the article in the paper recently about a controversy with a local health department director where he received a lot of criticism through social media. And I just have to tell you, having worked with these folks now since mid-May, these are local heroes. These folks They're not politicians. They're they're basically public health experts who work tirelessly for their community. And if I could read every one of their names here, I would. But I do want to call out just a few that helped with this effort during August. That would be Matt Hunt down in Barron River and Bowling Green, Kayla Bebow in Christian County, Sarah Jo Best at Lincoln Trail in Elizabethtown, Sarah Moyer over in Lexington, Lynn Sadler up in northern Kentucky, Sean Crabtree in the Lake Cumberland District, Scott Lockhart and Andrea Renfro at Kentucky River and Bullitt County in particular. All these folks either have volunteered on committees, have worked with the commissioner or myself, or are the staff members at the Department of Public Health. And as I said, if I could read every name, I would. But those folks are folks that went above and beyond the call. Communications is really the third aspect, and this is really a public education effort that has been undertaken to try to make sure that people understand just what contact tracing is and isn't. Here we've continued to make a lot of progress with communications, although it seems like that we just have to continue our efforts there just because of the nature of the disease and the diversity of people that we're trying to reach. A couple things to call out there is that we have added a number of foreign language additions to our printed material. They're now printed in addition to English and Spanish, Burmese, Somalian, and Chinese. And I also would draw folks' attention if you download materials from the KY COVID-19 website to also take a look at that presumptive eligibility white paper as relates to Medicaid coverage. I think this is of critical importance, particularly to underserved populations or folks that don't really have ready access to health care. One of the benefits that's available is almost immediate eligibility for Medicaid if you meet certain requirements. So taking a look at that, I think, would be of interest to a lot of folks, especially the advocates for some of our underserved population. If we could go to the next slide. Just a couple of comments. I mentioned the local health department directors and some of the challenges they face. I think one of the other things that I've seen in the press of late and have been asked about is just how effective is contact tracing. With the spread of the disease, isn't that going to overwhelm any capacity that you have to do contact tracing? And the reality is, in some states, they've had significant problems with that. Here in Kentucky, generally speaking, we have not. We have had some isolated instances in counties that have had spikes that they've had trouble keeping up with, but they've caught up, and we are able to. We do have the capacity, basically, in terms of the staffing and the tools available to the staff to effectively contact trace. Now, having said that's not the way out of this, and it's important, and I think the governor emphasizes this, and as does the commissioner, that it's just one component of the response. So we have to mask up, we have to socially distance. I'm not personally going to any restaurants to eat right now or going to any football games. We just need to do those things. If we do those things, it will help limit the spread, and if we do all that, we do have sufficient capacity to do effective contact tracing in the Commonwealth, and in fact are doing that right now. So it's all on us as a group of citizens to do the right thing, and to borrow a phrase, we'll get through it, and we'll get through it together. Thank you all.
I think a time of crisis, in this instance a pandemic, shows who people truly are. If you are threatening a local health department worker, if you are hiring an attorney to threaten them because you don't think somebody should have to be quarantined, if you are blowing them up and calling them a liar on Facebook, you're being a jerk. It's pure and simple. Don't be a jerk. This is the crisis of our times, and they are on the front lines working as hard as they can, and they're not getting paid any more for doing what they're doing. If a crisis shows who we really are, it's showing they're really special, amazing people. If you're one of the people threatening them or treating them badly, you ought to think about what that says about you. But the crisis is still going, so there's time. Let's make sure that we do things right. All right, I started over here yesterday, so Debbie, you want to kick us off?
Wondering on the contact tracing, if Mark has any actual numbers to show how successful they are reaching people, how many folks they're getting, what percentage of calls are successful in
Okay. The question, Mark, is about any data on number of workers, number of calls, success in reaching people.
Yeah, thanks for the question, Debbie. We still are primarily relying on anecdotal data coming from the local health departments as to how successful we are. That's why I described the update of the system and the implementation of it. So I expect by the end of this month that we're going to have very good data coming out of that system that's pretty comprehensive across the Commonwealth, where we can report on what's coming out of our systems in terms of successes. In terms of the anecdotal information, it sort of varies across the Commonwealth, anywhere from I hesitate to throw out numbers, but anywhere from 50 to 70% of the contacts are made. But we will have better data in about 2 weeks, I think, to be able to report on that.
Lawrence?
The Supreme Court hears the case involving your executive orders. Talk about what your argument's going to be and what's at stake in that hearing.
The question is about tomorrow's argument in front of the Supreme Court, where a lawyer from Northern Kentucky and the Attorney General are trying to get the court to throw out and nullify every single rule or regulation in place to keep us safe during COVID. It's pretty simple. If they win, more people are going to die. Every single public health official talks about the things that we are doing, what these rules are about: social distancing, limiting capacity, wearing a mask are the things that keep people alive. The number one thing they want to challenge is the mask mandate, and let's put up the head of the CDC again from this administration and what they said. Our argument is going to be that under the Constitution, the governor is tasked with responding to emergencies. Think about it. The governor is a full-time state official, and originally the legislature only met every other year. It'd be kind of nice if that was still the case. But could you imagine if, in the midst of a pandemic or a war, that we had 130-something people that had to debate the steps that we would take every day? There's also a whole chapter of statutes that have been put in place and have been in place for a while and never been challenged that says you can do all of these things. They're trying to invalidate numerous laws that have been passed by the legislature to say, well, we don't like them anymore within this context. This is something also that every other governor across America is doing. Virtually the same steps that I have, and they're not being challenged because people believe that the governor has that authority, or they're not being challenged by an attorney general. But Lawrence, I don't get it. If they win, we still lose. We will do worse in our fight against COVID. It will spread more. More people will pass away, people that we all love and care about. I mean, it's trying to undo the number 1, 2, 3, and 4 steps that we can take to defeat the virus. I mean, it's just crazy to say, let's eliminate the authority to respond to an emergency in the middle of the emergency. Now, they want to make arguments like, well, how do we know when it's ended? Well, when it's ended. You know, every pandemic in human history has ended at some point. The Spanish flu ended. I mean, a lot of silly stuff that you'll hear that they argue. Listen, I don't want to be putting these rules and these regulations in place, but I know I'm fighting for lives and health of Kentuckians. And if we don't do these things, the White House would tell you it'll wreck our economy. If we don't have people wearing masks, we can't keep the virus down, and there's no way our kids will be back in school. And if they win, it'll also eliminate workers' compensation for frontline workers who are quarantining. Right, for those that are fighting so hard against us. It'll eliminate the grounds upon which we provided funding to our schools when they were doing NTI in the spring, and eliminate a teacher's ability to work in a different subject right now if they have health conditions and are helping on the NTI side. The decision will be also one that's about life and death, but I think it's pretty clear that the authority is there. What this all comes down to is they just don't like the decisions that the person who under the Constitution and Kentucky statute has to make the decisions. I will tell you, it's not fun being the person that makes the decisions, but I'm going to keep doing what it takes to protect human life. And if they want to sue me on that, it says something about them, not about me.
Contact tracing part of this. Is there any metric or any way or any number of cases that you know definitively have been discovered through contact tracing?
The question is, do we have a statistic on how many cases that we can definitively say have been discovered during contact tracing? No. So in contact tracing, if you have been in direct contact with an individual who's tested positive, the majority of the time you'll be asked to, if the level is enough, is to quarantine. And then if you start feeling sick and you start feeling bad, it may be suggested that you get a test or receive medical attention. Some of those folks may never actually be tested. Now, I know a lot of them go out and get tested, and sometimes that's recommended too. I know individuals that have quarantined, have gone and tested, have tested negative, but have still completed it. But I don't think, Steve, that we have a number that we can directly say is related. That's a good point. Yeah. So what Dr. Stack added with his wisdom is that the way we find out where clusters are, where we're seeing a larger spread, multiple cases together, is through the contact tracing. So if you go all the way back to our first cases in Cynthiana, we could connect different people. And once we connected them, whether it was the place they worked or the place they worshiped, that let us go out and ask other people to get tested, check on them, to provide services before things could happen. Right now, it's really important on the school side to reach out and to make sure that we can find those that might have been infected. You had a school where a weight room really led to a spread. Well, a lot of that contact tracing led to the testing that led to the positive results. Karen?
You mentioned the issue they found with the clerk's office going into quarantine. They were able to make adjustments fairly quickly. If something were to happen at clerk's offices the week of elections, are there plans in place, or will each county come up with their own plan? How's that going to work?
The question is, with what happened in the Fayette County clerk's office with I don't know if it's a COVID outbreak, but an individual at least testing positive, resulting in difficulty, do we have plans if that happens in other places? I'm not aware of a formal plan that's in place, though tomorrow we'll have the Secretary of State and the Chair of the Board of Elections who work with them directly. I can say I'm ready to provide any assistance necessary. We have the National Guard help with the primary elections, and so we'll be ready to provide whatever resources are necessary to make sure that we have a full and fair election and hopefully break a turnout record. Tom?
Governor, the Trump administration today unveiled their vaccine plan, which requires states and local governments to have storage and distribution plans put together. Interestingly, on the federal level, distribution will be your friend from the McKesson Corporation. But is the state working on such a plan? Do you have any idea when it might be finalized?
The question is based on an announcement from the Trump administration today about planning on vaccine distribution and storage. We are in the process of making those plans now. For those of you that went to the PPE warehouse the other day, we do have refrigeration units there, and we'll need more and additional locations. Now, I do believe that the head of the CDC testified today that his expectation on vaccines is next year, like we've been talking about. I hope it's early next year, but we got to be reasonable in how we look at that. Now, me saying that is not an attempt to take any political side in any political debate, because it will still be the fastest in human history. But we do have to let the science take its course, and we do have to make sure it's safe, because I'm going to be asked to sign a form for my kids on it. And I intend to do that. I intend to do that when I know it's safe, and we'll be talking to the people of Kentucky about it. And my plan is still to take the vaccine right here at 4 o'clock someday to show people that I believe that it's safe. Catherine?
During that testimony today, the director of the CDC said he could see the U.S. returning to regular life by the third quarter of 2021. Does that make sense to you? How do you react to that? And what would you say to Kentuckians about sticking with these precautions until that time?
So the question is about the CDC director talking about next year, the vaccine starting to be distributed, talked about how long it could take to get vaccines to 300 plus million people in the United States. And it's not just that, but to convince the American people, which federal government has a duty to do, and we do too once we believe it, that the vaccine is safe, and to create the type of confidence, which will take time too. I think that is within their time frame as well. And I think what he's talking about when he's saying maybe the third quarter next year that life gets back to normal is normal. When he thinks enough people, if it's available at the time, will be able to do things in a virtually unrestricted way. We ought to expect to do a lot of these practices through the end of the year, and then it'll depend on how safe the vaccine is, how quickly it can be manufactured, the distribution network, and how many people are willing to do it. There's a chance we could beat that deadline in Kentucky depending on when it came out, but it's all going to be on us to do. A lot of what they talk about, and I got educated on this by Dr. Stack today, the percentages of people that need to take it, that's the percentage that needs to take it to protect someone who hasn't taken it from the virus. So we're going to be looking to not only create our plans, but the communication approach, which is really just honesty and truthfulness, though, to get the information out to people. Nick?
Moving back to normal. I mean, we're about to see a lot of students go back to in-person classes. We're seeing people go to football games now. And we're seeing, like you kind of looked at a little bit on the constraint on restaurants yesterday. Does it ever worry you, though, that with all these moves, we might see some negative effects because of that?
Yes. The question is on all of the things that we are now moving towards doing. And I think that's in-person classes. It's kids back at our universities. It's sports on all levels. It's different capacities that have increased in different things, conventions, concerts, different things that are happening. Am I concerned we can see negative results? Yes. Now, we know a lot more, and we have a lot more in place now, testing, PPE, contact tracing, which you're seeing, but there's no question that we are, you got the risk that moves up and down, and you can mitigate that some by the tools that you have, which we have. But in the end, how well we can protect our people here in Kentucky, I think, comes down to a pretty simple equation. It's the best rules and restrictions you have times the number of people who are willing to follow them equals the level of safety we've created in Kentucky. And so, there's some times where we got to let a little pressure out of the balloon when people are getting restless, and it's hard. And understanding that there's you got to balance that in the best way possible to get people in the very best place to protect the most around us. And it means that decisions aren't easy, and that there are times where you believe that if we don't take an extra step, that let people do a little bit more, that people will stop wearing masks that are wearing them. It requires a tough decision there. But yes, every time we increase our contacts, I worry about it. And I hope people do too. That's not that they don't do it, but if you think about all of it as the risk you're taking, don't just say I'm willing to take a risk or necessarily I'm not. Think about the levels of it. I mean, again, we talked about it a long time ago. How many things do I do in one day? Right? If I go to work, do I also then go to a restaurant and go to a bar and go to a sporting event all in the same day? I mean, your contacts get that much bigger. If you live at home with somebody who is in a danger zone, then even more. you want to limit that. And you got to think about all your family's contacts too. So I'd ask people, yeah, worry about it if that makes you try to make wise decisions and spread those contacts out. Debbie?
Our education folks were wondering if you could remind us again how you settled on September 28th as the day you weren't going to do in-person classes, and just for like the data and so forth, and maybe for superintendents to rely on.
The question is how we came to September 28th as a benchmark for our recommendation on not returning to in-person class. It was based on a number of things. One was where the positivity rate was at the time. And at the time we did that, we were still seeing what could be escalating cases, or certainly cases at a very high level. Knowing that the data trails even about 2 weeks in what people are doing that we're getting in, knowing that we needed to give longer for the mask mandate to work, and wanting to have a period of time where we could watch other states that were going back to school. And I wanted to see about a month worth because, again, their data trails about 2 weeks. We wanted to make sure that we could then make recommendations based on actual experience in other places. And in my address the other night, I said, we're not just doing what our experts think might happen. That's not the only basis of our decisions. It's based on what we see actually happening in other places. So it was based on where we were at the time, giving us a period of time to decrease that positivity rate, which we have, and then making sure that we saw in reality what was happening in other places. I think that some, when I provided that, thought that it was a little long, but if we'd only done it at 2 weeks at a time, you would have heard the same level of criticism about not having the certainty. Listen, all these decisions are between tough and tough. And so you make the best call you can, and you deal with the criticism for the tough you choose. Lawrence?
Decided on its winter sports schedule now, including starting basketball at a normal date, although delaying practice. Any thoughts on winter sports like basketball, whether there should be crowds, any guidance you can give there?
The KHSAA, and I haven't seen it today, apparently put out some schedule on winter sports. I think they also said they're going to be sending some letters out to systems or schools that have not been following COVID procedures. I've at least seen some pictures that suggest there have been some games where apparently nobody observed the rules at all, and that can't happen. I mean, these are our young people. That can't happen. And so I hope in any of those games, everybody from the referees, they should not blow that whistle to start that game if they look around and see folks not following the rules and the regulations. To the principals, to the coaches, to everybody else has almost a sacred responsibility in doing something like sports during a pandemic, and all of them need to make sure that they live up to that responsibility. And it's not that hard if you are in a position of leadership like that to make sure the right thing's happening. We all have concerns about winter sports, and we're not there yet. I mean, for instance, the NBA, which is inside, is playing with 0 fans. They've got some of the best doctors in the world. I think they helped invent one of the new testing methods, and they're still not doing fans. So we got to think really hard before we have a gym full of folks. And I don't know any of our gyms being well ventilated, though we have a lot of more modern high schools. So we'll have to carefully look at that as we move forward. Let's remember some of the inside sports we have seen in practices a little more spread than maybe we thought, volleyball for one. So we're just going to have to be careful as we move into it. We're going to learn a lot from the sports that are being played right now.
What's the status of that mandate in terms of when it's set to expire next? And given the CDC director's testimony today, do you anticipate extending it beyond where it's set to expire?
So we have put our mask mandate, and the question is on its expiration date. We've been doing it 30 days at a time. I think we're halfway maybe through this 30-day period. People should expect another one. It is an effective tool. It's helping us get our kids back into school. If we eliminated the mask mandate right now, our transmission map would look entirely different, and then the guidance for so many other things would change. Every public health official, all of them now, are saying we all need to continue to do this. Karen?
employment, many of the cases left are those two-page letters. But we've heard from some listeners who've had some weird anomalies, like they've gotten a debit card but no money has ever dropped, or they got their first check and then they stopped and they can't get a hold of anyone. What should they do?
The question's on unemployment, and then I think Steve had a comment on the last question, Dr. Stack, so if you want to head on up as I answer this. First, we are making significant gains in the backlog of unemployment claims. I think we did over 1,000 of those determination letters, I think just yesterday, and so the pace is significantly picking up. And that's good news, because some people who get a denial in those letters may qualify for pandemic assistance, but they can't get it until we can get them that determination. We are working hard to get those secondary claims addressed, those that have gotten a first payment but may have made a mistake in requesting the second one. Remember, the system's set up to where you have to request it a certain way. Our hope is that we very soon get back to regional in-person services. But if you want to forward specific information, we'll try to reach out to them. I think Dr. Stack wanted to add something on the mask mandate.
Thank you, Governor. I did want to add something specifically on the mask mandate. So I retweeted and I shared Dr. Adams, the Surgeon General, sent out in the last 40 minutes. Coronavirus is real and it can kill you. No matter how you feel about it or masks, we won't be able to reopen and stay open if it is still being spread. Wearing a mask isn't hard, and if it can help us reopen, then why not try it? You know, I want to make a few points on this. So anyone who's ever had surgery, surgeons wear masks sometimes 10, 12 hours at a time in an operating room. And any of you who ever have your abdomen or your chest opened up or your skull opened up so they can work on your brain will be very grateful that they're wearing a mask and not spraying saliva into the inside of your body. I think we need to start thinking about that a little bit more. I have a real difficult time understanding when grown adults are saying they can't breathe through a mask. I think they have misunderstood inconvenience with inability. It's just sort of like when you talk to your child and you say, I think you have your needs and your wants confused. We have got to get over this inconvenience somehow being an infringement that is offensive to us. This is the tool we have so that we can get back to activity. I am finding, and I'm sharing a little frustration with this, my colleagues at the local level are getting a lot of pushback from a small number of people. So first of all, a small number of people, the majority of you, thank you. You're doing the right thing, and thank you. Please keep doing the right thing. Please modeling this behavior, or continue to model this behavior. Let's help others to go on this journey and do what needs to be done instead of finding excuses to avoid what needs to be done. But for the small number who are really being inconvenienced about this, there's no appeal to me around the local health department leader who has the authority. The local health departments and their leaders are public health professionals and experts. They don't try to tell people how to run schools or run businesses or run manufacturing facilities. They do public health. Please respect them for their expertise, just like they respect all of you for yours. Wear these masks, please. This is the tool we have until next year when hopefully we get a vaccine that's effective, that we can distribute to enough people. As soon as we get one of those, or more than one, hopefully, we will start to do everything we can to make it available so we can get away from this, because they are inconvenient, but they are certainly effective, and they are certainly something the vast, vast majority of us can do. And whether you are Democrat or Republican, you're seeing that the White House folks, the Beshear folks, we're all saying the same thing. Whether it's Trump or Beshear, the science experts are delivering the same message. We're not trying to make people feel bad. We're just trying to get us through this. And the more we resist it, the more the disease spreads. And then the more people who get exposed, the more people get infected, the more vulnerable people suffer the price of losing their life, and the more people who get quarantined, because there's a lot more infected people out there to expose us all. So please, it's an inconvenience, but it's what we have to do to get through this. We can do this. We did it in the spring. This is a lot less intrusive than having to stay all healthy at home in the spring. We can now get healthy at work and healthy at school, but we've got to wear these things to do it safely and effectively. Thanks, Governor.
All right, looks like one last question. Do I support legislation? 2 different bills have been filed giving state workers 12 weeks of paid family leave. I believe paid family leave is a powerful tool that can address inequalities in the workplace, whether public or private, most often affecting women as they're having families and children and have a lack of some type of program to address it has led not only to contributing to unequal pay for equal work, but also issues of advancement. Now, only 8 states have approved legislation on it. I think it's only about 4 that have it in place, so it's one where we'll really have to look through the details, the funding, and the rest, and I'd want to look at those. But this is an important tool that many in the private sector have found to be hugely important in retention and in having the very best that this state has to consider. And we have got to get to a point, whether it's through this or something else, where people are finally treated equally in our workforce. It's something that almost every other country does in paid family leave, and if this is the tool that can help get us there, then we have to seriously consider it. All right, we will be back at 4 p.m. tomorrow and then off until Monday. Again, everybody, wear your masks. If not me, do it for Dr. Stack, who brought the fire tonight. It's obviously incredibly important. His passion for it is based on his absolute knowledge of how many lives this could save and the difficulty when some just aren't willing to do something so small to help so many. So we'll get through it. We'll get through it together. And this is one big reason why. Thank you, Franklin County Flyers, for a great mask. Thank you.